All right. So we're looking at the next surgical procedure. All right. This is what is known as what? Laparoscopy. Laparoscopy. So for this laparoscopy, you can see it. You just have to do it. You are doing what? Surgeries in the abdomen or surgeries close to the pelvis and perineum. Do you understand? But it's just through what? Some tiny holes. You know, you are not like opening the person like laparotomy. Okay? So laparoscopy is just a minimal invasive surgical procedure. So it's used to examine and operate on organs inside the abdomen and pelvis. Alright, so it's often referred to as a keyhole surgery. Right, so they are doing the surgery right inside the abdomen, but they just did some small holes. So it's through those small holes they put those things. They're not opening the person totally. Now we get to talk about the advantages of this type of surgery. So what is laparoscopy? This thin tube you are putting inside is called a laparoscope. It's inserted through a small incision in the abdomen. The camera transmits the images to the monitor. So as the person is observing, as he's putting everything inside here, he's looking at the screen. Alright, what is happening? So additional small incisions may be made to insert surgical tools if needed. Alright, so common uses is used for both diagnosis and treatment. Alright, so diagnosis, you can diagnose abdominal or pelvic pains, remove cysts, fibroids or tumors, treat endometriosis or ectopic pregnancies, perform biopsies, can do all those gallbladder, surgeries, appendix removal, hernia repair, tubal ligation or reversal. All right. So benefits, why they now do this thing? All right. Why they do this is those small holes, when they heal, there's little scars, and there's less pain than they are opening you through a large area. There's lower risk of infections, there's lower risk of complications. So it's often performed as outpatient surgery. Risk factors is generally safe, but it can lead to bleeding, infections. There's damage to internal organs, adverse reaction to anesthesia, post-operative discomfort like abdominal bloating, shoulder pain from the gas used in the procedure. Okay, so that's just what we have for laparoscopy.